All right, let's jump right into this explainer and completely demystify the newly updated 2025 guidelines for managing high blood pressure. If you ever stared at those two numbers on your medical chart and wondered, okay, but what does modern science actually say about this? Well, you're in exactly the right place. Today, we're breaking down the ultimate blueprint for protecting your cardiovascular health. We've got a super clear roadmap for today. First, decoding your blood pressure, then the kidney damage cycle, the new 2025 treatment guidelines, the power of lifestyle changes, and finally, smarter medication strategies. Section 1. Decoding your blood pressure. What the numbers mean. So, what do your blood pressure numbers actually mean? I know, it sounds incredibly basic, but honestly, this is a question almost half the population really needs to ask themselves. Why? Because these numbers are the ultimate, undisputed indicator of your cardiovascular health and your risk for future disease. Okay, so your blood pressure reading is really a tale of two distinct forces. Think of it kind of like plumbing. That top number, the systolic, well, that's the active, explosive pumping force of your heart pushing blood against your artery walls. It's literally how hard your heart is working when the pump turns on. Then you've got the bottom number, the diastolic. That measures the resting resistance in your pipes, your arteries, between heartbeats while the heart is refilling. And, as we get older, our arteries can get stiffer and narrower, which is usually why that top systolic number starts to climb. And just to put this into perspective, the scale of this problem is absolutely massive. According to national data, 48.1% of US adults have high blood pressure. That is nearly 120 million people. It's a massive, hidden epidemic. And the craziest part? Only about a quarter of those folks actually have their numbers properly under control. You might want to actually take a screenshot right now because this chart is your personal baseline. It clearly lays out the newly updated stages of hypertension so you can see exactly where you stand. So a normal reading is less than 120/80. If your systolic creeps up to that 120 to 129 range, you're considered elevated. Stage 1 hypertension officially starts at 130/80, and stage 2 hits at 140/90. And listen, anything over 180/120, that is a hypertensive crisis, and it means you need immediate medical attention. Knowing exactly where you sit on this chart is literally your very first line of defense. Moving right along to Section 2, the kidney damage cycle, a really dangerous loop. Here's the crucial point, and it's a vicious cycle. High blood pressure doesn't just make your heart work harder, it actively destroys the delicate microscopic blood vessels in your kidneys that are supposed to filter your blood. When those vessels get battered and hardened by all that high pressure, the kidneys are starved of oxygen and nutrients, so they fail to filter your blood properly. But wait, it gets worse. They also lose the ability to regulate a hormone called aldosterone, which controls fluid and blood pressure for your whole body. So damaged kidneys can't manage the hormone, which causes your blood pressure to spike even further, causing, you guessed it, even more kidney damage. It's a brutal, dangerous loop that we absolutely have to break. Which brings us to Section 3, the 2025 treatment guidelines, the updated protocols. So, how is the medical world fighting back? Well, the new guidelines lean heavily on a powerful tool called the Prevent CVD equation. Instead of just looking at your raw blood pressure numbers in a total vacuum, this new equation, which, by the way, you can start using at age 30, factors in the whole picture. It looks at your kidney function, your blood sugar control, whether you take a statin, and even your social deprivation index. It takes all of that data and predicts your highly personalized 10-year cardiovascular risk. It's just a much smarter, more holistic way to look at your health. So what does that actually mean for you? It really all comes down to the 7.5% threshold. If you've got stage 1 hypertension and this new equation says your 10-year risk is under 7.5%, the guidelines suggest 3 to 6 months of intense lifestyle changes before even touching medication. But, and this is a big but, if your risk is over 7.5% or you have existing conditions like diabetes or chronic kidney disease, the guidelines say start medication immediately, no delays. This is a total game changer because your specific risk profile now dictates your exact treatment path. Also, the 2025 guidelines set a brand new universal target for almost everyone. Get that pressure under 130/80. And the reason for this is fascinating. Getting below that threshold doesn't just save your heart and kidneys. A massive review over 200 studies found that hitting the systolic target reduces your risk of dementia and cognitive decline by a whopping 21%. Basically, by keeping the pressure down, you're protecting those tiny, fragile blood vessels in your brain from chronic, long-term damage. All right, Section 4, Power of Lifestyle Changes, Natural Interventions. Before anyone reaches for a prescription pad, we need to talk about lifestyle, because clinical trials show these simple changes act like highly potent natural medication. Take the DASH diet, dietary approaches to stop hypertension. It's all about fruits, veggies, whole grains, and lean proteins, while seriously cutting back on salt, added sugars, and saturated fats. I know it sounds tough to stick to, but doing this can drop your systolic pressure by a massive 12 points. Combine that with just 30 minutes of a daily walk or some aerobic and isometric resistance training, and you are actively helping your heart pump blood so much more efficiently. These aren't just polite suggestions, they are frontline, evidence-based treatments. And finally, Section 5, Smarter Medication Strategies, Maximizing Potential. Okay, but what if lifestyle isn't quite enough? To understand this shift, let's look at some fascinating claims data from Medi-Cal RX, which exposes a massive medication adherence crisis. We know that frontline meds like ACE inhibitors, calcium channel blockers, and diuretics, they work beautifully. But nationwide, adherence is often estimated to be less than 50%. The data shows a huge gap between what doctors prescribe and what patients actually take day to day. Just look at these numbers. They are truly staggering. When researchers looked at patients taking multiple medications for high blood pressure, over 99% of them were trying to juggle loose, separate pills. Less than 1% were using single pill combinations. Trying to manage all those different pill bottles, different schedules, and different pharmacy copays, it creates an enormous barrier to actually taking the medicine consistently. So to solve this exact logistical nightmare, the American Heart Association has a huge new push. For stage 2 hypertension, they now strongly prefer that doctors prescribe 2 frontline medications combined into one single fixed-dose pill. It's such a no-brainer, right? Combine the drugs into one pill, make it easier and faster to take, and you're far more likely to actually hit that critical target of under 130/80. It's a super simple logistical fix, but with profound medical benefits. All right, so we've covered the mechanics, the hidden risks, and the state-of-the-art solutions. The ultimate question to ask yourself is, do you know your Prevent CVD risk score, and is your medication strategy actually ready for a 2025 update? It is time to take control of your cardiovascular health. Ask your doctor to run your numbers through the new equation, and hey, if you're currently juggling a bunch of different blood pressure bottles, ask them if a single pill combo is right for you. Thanks so much for joining me on this explainer, and I will see you next time.